So we are discussing the principles of the drug action or types of drug action, in which we are discussing the depression. Certain drugs stimulate one type of cell but depresses the other type of cell. For example, acetylcholine. Acetylcholine stimulates the smooth muscle of intestine and depresses the SA node of the heart. Means same drug which act as a stimulant and depressant also on a different organs. So acetylcholine stimulates smooth muscle of intestine. That means it increases the tone of gut, it increases peristalsis, and it also increases gastrointestinal secretions. And acetylcholine depresses the SA node of the heart. That means there is decrease in the heart rate, force of contraction, and AV nodal conduction. Hence, most drugs cannot simply classified as stimulants or depressants. Now we have third type of principle, that is irritation. Certain drugs on topical administration or topical application can cause irritation of the skin, mucous membrane, and adjacent tissue. Certain drugs on topical application can cause irritation of skin, mucous membrane, and adjacent tissue. For example, sodium hydroxide NaOH, it can cause corrosive action. On topical application, it can cause corrosive action. Astringent action like precipitation of protein by alcohols. Astringent action like precipitation of protein by alcohol, like spirit, is having astringent action. Counter irritant action like it relieves deep seated pain. It relieves deep seated pain. And we have various counter irritant like methyl salicylate, eucalyptus oil, camphor, menthol, capsaicin. These are the active ingredients which can cause counter irritant, which are act as a counter irritant, which relieves deep seated pain. Camphor, menthol, capsaicin, methyl salicylate, or eucalyptus oil. But by which mechanism it act as a counter irritant? It increases local circulation in the deeper structure by causing local vasodilation. It increases local circulation in the deeper structure by increasing or by causing local vasodilation. It also blocks pain impulse conduction in spinal cord. It blocks pain impulse conduction in the spinal cord. So this is how they act. Now the fourth property or fourth principle is the replacement. Replacement means whenever there is a deficiency of endogenous substance, that should be replaced by drug. Whenever there is deficiency, it should be replaced by drugs. In case of diabetes mellitus, there is deficiency of insulin, so that endogenous insulin is replaced by conventional insulin or conventional preparations of insulin, human insulin. In case of myxedema and cretinism, there is a deficiency of thyroxine. In case of iron deficiency anemia, there is a deficiency of iron. So we have to prescribe various preparations of oral and parenteral iron preparations. In Parkinsonism, there is a deficiency of dopamine. So we have to give dopa precursors like levodopa. So what we are doing, we are just replacing the endogenous substance by drugs. Then lastly, cytotoxicity, selective toxicity for the infective organisms and cancer cells. Cytotoxicity. Chemotherapy, we can say chemotherapy, selective toxicity for the infective organisms or microorganisms or cancer cells. So antibiotics or antimicrobial agents and anti-cancer drugs, they act through the principle like cytotoxicity. That means they are selectively toxic for the infective organism or cancer cell.